CSU stands for chronic spontaneous urticaria. Urticaria is the medical term for hives. This is a condition that affects 1% of the general population. There are 1.7 million Americans dealing with this condition. It presents as terrible itching, hives, and/or swelling that progresses beyond 6 weeks. This can occur to any age. Typically, 20 to 40 is our peak. Females are twice as likely to deal with this condition versus males. So typically we start with allergy meds, with antihistamines. This is a condition due to our allergic cells releasing histamine. So we want to try to play defense at first, try to block that histamine. It often requires higher doses of allergy medication than patients would typically take. We can increase up to 2, 3, or 4 times the standard dosing of allergy medication. And for those patients that break through antihistamines, the next recommended step in therapy is Xolair, which is a monthly injection approved for patients 12 years of age or older who are dealing with chronic spontaneous urticaria who fail high-dose antihistamines.
I want to thank Genentech and Novartis for the opportunity to present awareness, use this platform to bring awareness to CSU, because the symptoms they have no known cause, or the diagnosis has no known cause. I started experiencing symptoms randomly one day. I woke up with an itchy neck, and I thought it was because I slept in jewelry. The itching persisted throughout the day. I even took an antihistamine and didn't get any relief. Over the next couple of days, my itching intensified to the point that I had developed hives and whelps, and I also started to break skin. I would go to see doctors who would prescribe oral steroids that didn't provide any relief. Finally, they referred me to an allergist, Dr. Zelick, who did some blood work and diagnosed me with CSU to get me on that road to recovery with Xolair. Having this diagnosis, it was hard at first because I wasn't able to do my day-to-day activities, go to work and do my responsibilities as a mother, but I documented my journey so that I could accurately articulate to my healthcare providers my symptoms and medications that I was taking, so that they could assess and give me the proper diagnosis to get me on the road to recovery. So today I am more stabilized. I take Xolair once a month, administer it at home, along with some lifestyle changes that were recommended by Dr. Zelick, like managing stress. So now I would like to tell other people that there are treatment options that are available if you have dealt with symptoms, or you are dealing with symptoms like similar to what I was dealing with the sudden itching, hives, and things like that, that you don't have to suffer in silence. I would recommend consulting with a healthcare provider, or going to Xolair.com, XOLAIR.com, to see if those treatment options are good for you.
So I think the take-home point is that this is a very common condition, often goes undiagnosed or misdiagnosed for far too long. And if you're struggling with this or know anyone that is, please recommend that they see their local allergist to talk about their condition and treatment options.